All right, we are back with one more segment with Dr. Nagappan from Cone Health, and he's talking all things COVID and back to school. This text question says, if my child is between COVID shots, how much protection do they have as they're starting this school year?
They've got, after the first shot, you've still got reasonable protection against hospitalization, but probably pretty minimal protection against actually getting COVID. It's pretty low after that first shot. You really need the second and maybe even the booster to get like your max benefit.
So again, washing the hands, wearing the mask if you can, that kind of thing.
They'll take all those precautions after the first shot.
Okay. We've heard a lot about paxlovin and how people get that to minimize the variants of COVID and things of that nature when they get it. Can kids use paxlovin?
Kids can, but it's much less common in kids than in adults. And so it's approved for kids over 12 years old and over 88 pounds. So it's, kind of that specific group. And then in addition to that, you have to have some high risk factor. There's a long list of those things. It can be, underlying diseases, lung diseases, heart diseases, and all sorts of stuff. If you have those things and meet the criteria, then, Paxlovid could be a benefit to you. So if it's something, if your child has COVID and they meet those high risk criteria, it's something you can talk to your doctor about. But I will say, we've used it very rarely just because most kids don't have enough high risk illnesses to really warrant using it. But there's definitely a role for it in some kids.
Okay. Oh, what about kids that maybe have a disability or things of that nature? Maybe some parents there are really worried about getting the vaccine.
Yeah, so that's a great question. Kids with disabilities can get this vaccine just like anyone else. Many of the kids in the studies had disabilities, so it's been studied in those kids. It works just as well. And so I wholeheartedly recommend that people get it. Certain kids who've got immunocompromise may actually need an extra dose, and that's something to talk to your doctor about the specifics of that. There's also, I think, sometimes parents are worried about well, if I go to my local pharmacy, is it really, my child has trouble with needles or they've got a disability, will they really be able to accommodate what they need? And there actually is a hotline. It's called the Disability Information and Access Line dial that people can, you can Google that phrase and then you'll get an email and a phone number. If you call that or email that, they'll give you advice on places to go that will make accommodations for kids with special needs.
And say that again. Say what they need to Google for the number.
It's called Disability Information and Access Line.
Disability Information and Access Line. Okay.
Yep. So that can be really helpful for those parents who've got special needs kids.
All right, we've got just about a minute left. Oh, let's see. This person says, the new CDC guidance, should I test my child if they were exposed but not symptomatic?
Yeah, so the new CDC guidelines say that if you're exposed, not symptomatic, they recommend testing at day 5. Long enough so that you're not going to get it too early and miss it. But then again, at day 5, so then you'll know if you've got it or not. So that's what the CDC recommendation is.
Okay, and really quickly, if parents are on the fence about getting their kid the vaccine?
I wholeheartedly recommend it. Again, I think yes, your kids aren't, it's not the same as in older adults where there's, lots of serious disease, but no one wants to be in the hospital with their kid. And so if there's something simple that you can do to prevent that from happening, I think you should do it.
Okay. All right. We appreciate your time and your expertise. We want to make sure that you at home don't miss any of this information. You may have tuned in a little bit later on. Head over to the To Your Wellbeing section of our website in just a few minutes. We're going to have all this information and the interview posted there.